Today we start with the bronchial asthma. What is asthma? Asthma is a chronic disease involving the airways in the lungs. These airways or bronchial tubes allow air to come in. This one and out of the lungs. If you have asthma, your airways are always inflamed. These are the airways. Passage of this one. Okay. This is the normal and this is the asthmatic. You can see the pores which are there inside. They become even more swollen and the muscles around the airway can tighten when something triggers. Okay. Tighten when something triggers your symptoms. Okay. This is the incubator one takes. There are three types of disease: bronchial asthma, bronchitis, chronic pulmonary obstructive disease (CPOD). Three types of diseases, three types of disorders. Okay. Asthma is a condition in which our airways narrows and swell and may produce the extra mucus. This can make the breathing difficult and trigger the coughing, a whistling sound when you breathe out, and shortness of breath. The three types of asthma are nocturnal asthma. This is the most common type of asthma. Exercise-induced asthma or exercise-induced bronchoconstriction. Physical exertion of patient during an exercise can trigger asthma in some cases. Allergic asthma, seasonal asthma, inhaling allergens is the most common trigger for inducing the allergic asthma. Asthma is of two types. One is allergic asthma, mainly caused due to dust and smoke. And the second asthma is due to the atmospheric disturbance. One is due to the internal dust and all, smoke and all, and second is for the internal external atmosphere also. So this causes the breathing difficult. The airways get constricted in bronchitis. The airways get constricted. So the flow of the inhaled air or the exhalation gets stopped up and gets abrupted. That is the idea behind it. Okay. Inhaling allergens is the most common trigger for inducing the allergic asthma. Okay. पेंटिंग घर में पेंटिंग हो रहा है तो कभी कभी पेंट का स्मेल ये नहीं होता है a smell which is not accustomed to the body and the mind and which the mind rejects, so that triggers into the asthmatic level or the bronchial asthmatic level. Okay. Bronchitis is the constriction of the airway passages, the bronchial tubes, which constricts the flow of the inhaled air. Okay. It passes from the nose to the pharynx, pharynx to the larynx, to the lungs, where there are bronchial tubes, that bronchial tube get congested and smoke. I told you the other day, person of 70-75 years old, complete carbon monoxide, his lungs is carbon monoxide. He expired. मेरे को बोला I want yoga training and all. The very proudly says, मैं 19 वर्ष से सिगरेट पीता था. From 90 income tax officer. Very proudly says. Then I saw his breathing capacity, not able to breathe in, not able to deep breathing. And I saw his X-ray, a complete carbon monoxide. I didn't tell. Then I told Malayali India. Then I told him, sorry, I will come after some days. Take rest. Breathing in hota tha. Ultimately expired. Okay. So why lifestyle is very important. What are the list of few practices and unique postures? Nadi Shodhan Pranayama, alternate nostril, Kapalbhati, skull shining breathing, Ardha Matsyendra Asana, Paul Muktasana, Setubandhasana. 8 tips can improve diaphragmatic breathing, simple deep breathing, counting your breath, watching your posture, staying hydrated, laughing, staying active, joining a breathing club. Okay. These are the steps to be taken, how to keep your lungs healthy. Now, other is a method of this one, sinusitis. The common condition defined as inflammation of the paranasal sinuses. Sinus cavities produce the mucus that nasal passages need to work effectively. Sinusitis can be acute or chronic. Cause of sinus inflammation includes viruses, bacteria, fungi, allergies, and an autoimmune reaction. Sinusitis is usually caused by virus and often persists even after the other upper respiratory systems are gone. In some cases, bacteria or rarely funguses may cause a sinus infection. Other conditions such as allergies, nasal polyps, and tooth infection. Sorry. Nasal polyps and tooth infection can also contribute to sinus pains and symptoms. Most sinus infections are viral and only a small proportion develops secondary bacterial infection. Rhinoviruses, influenza viruses, and para-influenza viruses are the most common cause of sinusitis. So, second disease after asthma is sinusitis. Most effective breathing is Kapalbhati. Active abdominal expulsion, abdominal exhalation. Okay. What happens in Kapalbhati? Usha, what happens in
सर कपालभातीमध्ये इनलेशन इज पॅसिव्ह, एक्झलेशन इज ऍक्टिव्ह.
आणखी काय होतं? What happens inside?
डायफ्राग्रामची पोझिशन चेंज होते.
Diaphragm bending वरती जाऊन it hits the lungs. So abdomen में ये करें. Most important step: inhale, fix your chest, exhale out partially, abdomen relax, and then do the abdominal stroke. Tap tap. Lower the bhata कसा असतो? तो lower tap 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 tap. So abdomen से it will get a touch up and it will hit the lungs. So lungs में active expulsion takes place. Okay.
बट सर अस्थमाच्या पेशंटला कपालभाती रेकमेंडेड असतं का?
Initial stage मध्ये.
Okay.
When advanced stage में असेल, you cannot do it. You will not be able to do it. Expulsion होणारच नाही. हळूहळू एकदम ट्रीटमेंट घेऊन एकदम त्याच्याकरता डीप ब्रिदिंगच करायचं. ओनली डीप ब्रिदिंग. Deep breathing, it will get set right, and then you go for the expulsion. Okay. Simple deep breathing is always best. Okay. Causes of sinusitis, a chronic sinus can become an infection growth in sinuses, nasal polyps, swelling of the linings of the sinuses. Signs and symptoms may include nasal obstruction or congestion that causes difficulty breathing through your nose, and pain and swelling around your eyes, cheeks, nose, or forehead. Here, this is the frontal sinus at the front. Then one which is below that is ethmoid sinus. One which is behind that is sphenoid sinus. Do not remember, there is just information, medical information. See a frontal sinus, ethmoid sinus, this is the ethmoid sinus, which is there below that. Then nasal cavity, here, nasal cavity. Then maxillary sinus, one below that. Okay. This is the nose, which goes inside. Okay. This is the fluid. This is in a adverse situation. This situation is adverse. This is a normal, this is adverse. Okay. See here, it is darkened here. Just see. Just see the compare here between these two. On the left side, you find the fluid and all everything accumulated. Here it is clean. So mucus started accumulating here. See the darkness here and the inflammation. See here it is all very clear. And obstructed sinus opening. See here. Okay. See the inflammation here. See the position here at the opposite side. What are the yogic kriya? Jaliti, Kapalbhati, Kapal Rantra Devati. Asana, Sarvangasana, Bhujangasana, Ustrasana, Konasana, Chakrasana. Pranayama, Ananam Vinam. Which is the next one? Hypertension, high blood pressure. Everybody knows diastolic and systolic blood pressure, systolic and diastolic blood pressure. 120/80 is the normal level. Above 140, 150 is high blood pressure. Okay. Always remember, blood pressure and diabetes will remain till the death. You can control through medicine, you can control through the yoga, but from the dosage of medicine can be reduced through yoga, provided lifestyle is proper. Okay, but there are instances, cases where the people have stopped the medicines for high BP and ultimately collapse. Whether प्राणायाम और एक्सरसाइज मेरे को कुछ तकलीफ नहीं है, केमिस्ट शॉप में जाकर पूछा है वो अभी लेता नहीं है, उसका भी योगा वेगा कर रहा है, लेकिन बाद में मालूम पड़ गया एक्सपायर हो गया. Stop the medicine. So never, when you teach any student, never stop the medicine. Doctor is a final authority. Doctor will say, depending upon his X-ray and all, whether he should uh, go in for reduction of the medicine dosage. 50 to 10, 10 to 5, 5 to 2.5. But the lowest medicine at that of that particular medicine should not be stopped. Okay. Psychological stress medicine, circadian synergy, body weight management, healthy dietary pattern, regular physical exercise, regular sleep-wake cycle, reduction in body weight in people with obesity, diet with low sodium, potassium intake, with lot of fruits and fibers and vegetables, endurance and resistance training, meditation and relaxation technique. Psychosocial, this is blood pressure management, psychological stress management, circadian synergy, body weight management, healthy dietary patterns, and physical exercise. These are the initial. Yes, these are little advanced. Meditation, relaxation technique, regular sleep wake cycle, eating during daytime, regular physical activity. Sorry. Then diet with a low sodium to potassium that everyone taken, high intake of fruits, tubers, and vegetables. So first, foremost is all this is to be done. Physical exercise, healthy dietary pattern, body weight management, then endurance and resistance training. Okay. So these all factors has to be taken for controlling the blood pressure. Okay. One of the most common health disorders prevailing is hypertension and high blood pressure. This occurs when pressure inside the blood vessels is higher than the normal expected values for age and gender. Yoga, when adopted as a way of life, has a lot to offer for those suffering from the stress-induced psychosomatic lifestyle disorder that is a silent killer. Diabetes is a silent killer. Hypertension also is a silent killer. Slowly, it will degenerate each and every organs. कौन सा organ पे इसके लिए when operation is going to take place of certain problem, they check the diabetes and blood pressure level. Diabetes high रहेगा तो they will not go in for operation. Operation will take place. They will try to reduce the blood pressure, diabetes level. Okay, either by insulin or tablets, by high doses of tablets. Then see that diabetes are normal, and then only they will go in for operation. इसके previous day of the operation, this is taken. Diabetes and blood pressure, all these parameters, physiological parameters are taken. Whether creatinine level is okay or not, okay, kidney level is okay or not, okay, then cholesterol level is okay or not. All factors are taken before any even minor operation or hernia or any inflammation. Okay. Now, hypertension is only after taking several readings. The blood pressure needs to be taken at least 2 times, and each reading must be from a different day. Okay. दौड़ के आ गया एकदम, very busy person, and he's always in a tension and all. Always his blood pressure is on the higher level. Okay. Immediately on taking the medicine and all. If the average of blood pressure is more than hypertension, then hypertension can be diagnosed. Okay. A single reading that is more than 140 does not necessarily confirm hypertension, but requires further monitoring. Okay. See, higher level hypertension is okay. Low blood pressure is very dangerous. Low blood pressure is very dangerous. See, up to 70 is okay. Systolic level. 70, 80, 70, 80. Okay. But below 70 is not advisable. 60, 65 is not advisable. Okay. The initial strategy in managing the hypertension should always include dynamic advocacy or lifestyle modification. However, in patients whose BP is on the higher side, medications will need to be taken along with the lifestyle modifications until their condition stabilizes. The aim should be to lower the blood pressure as close to the normal range as possible. Many therapists seem to forget that lifestyle changes are the first step in hypertension treatment. These changes can also improve the quality of patient's life as well. Lose weight, restrict the alcohol intake, increase the physical activity like walking, etc. Reduce the sodium intake to less than 100 millimeters. Maintain adequate diet or intake of calcium, potassium, and magnesium. Stop smoking and reduce the intake of saturated fats. Saturated fats and now, what is the yogic management? Involves breathing in certain patterns which can control the blood pressure as well as the relief. It will also enhance the functioning of your heart. Yoga leaves a positive impact on your mind and body. It is an effective way to lower the blood pressure. Here are some Balasana child pose. Each asana reduces and improves the blood circulation throughout the body. Controlled breathing while performing this asana promotes calmness and reduces stress from the neck and the other side. Cardio exercises. Cardio exercise best for their heart health as they enhance the flow of the blood. These exercises also burn a huge amount of calories and promote a healthy heart. Then second is, see, first is cardio exercise. Second is strength training. Strength training is good for the muscles and bones, also helps in burning a huge amount of calories. Household chores. Household can also burn the calories. It increases the movement of the day throughout the day. Movement day, climbing the staircase is a clever way to work out. It is a smart method to keep yourself fit. Skip the elevator and choose the staircase. Stretching increases flexibility. It benefits your body in several parts. It will specifically focus on the muscles and helps you prevent it basically improve the blood flow to your muscles. So these are the basic exercises. Now, Sukhasana is a popular way which regulates the breathing. Either it can be Makarasana or any position. By promoting a peaceful mind and reducing the stress, a relaxed mind promotes a healthy body. Shavasana or the cock pose is totally meant for relaxation. This is one of the easiest poses which you can try to control your blood pressure. Shavasana calms your brain. Okay. Shavasana calms your brain, relieves the stress, relaxes the body, reduces the headache, fatigue, and insomnia. Cobra pose, also known as Bhujangasana, is also helpful in circulating the blood and the oxygen. This pose also reduces the stress and promotes a positive health. Bridge posture. Bridge posture काय म्हणतात? Ustrasana. It calms the brain and elevates the stress. This asana is also beneficial management and depression. Pranayama, Kapalbhati, Anulom Vilom, Brahmari, full yogic breathing. Full yogic breathing is abdominal breathing, चिन मुद्रा, आदि मुद्रा, ब्रह्म मुद्रा, फुल योगिक ब्रीदिंग. हाथ को ये लगाने का, नाभि के ऊपर लगने का. Guided meditation as per the standard norms of yoga mudra. Okay, this also use. Now we come to cervical part, cervical spondylitis. Okay, mobile, TV. बच्चे लोग का ये अभी आजकल younger generation are putting the specs at a very early age. So 4.1718 talks about that. The side picture shows the stress on the neck due to the long hours of mobile watching. Is stress on the neck with 10 to 12. This at angular at 0 angle. 50 IBS with 40-degree deviation and 60 IBS with 60-degree deviation and home remedies. Cervical spondylitis is a general term for age-related wear and tear. What are the segregation of vertebral column? Usha, vertebral column का segregation क्या है? अनम्यूट करा.
पर आता लक्षात नाही आहे माझ्या. बट सर्वायकलचे फर्स्ट 3 or 5 years.
7 cervical, 12 thoracic, 12 and 7, 19, 5 lumbar, and 24, 9 fused bones. Sacrum, 5 of sacrum and coccyx. Okay, there are 33 bones are there. Okay, the sciatica nerve starts from the pelvic region. Okay, sciatica nerve is the biggest nerve in the body. Okay, the cervical mainly computer related, mobile, as seen here, continuously watching. Okay, the cervical spine is general term for age-related wear and tear affecting the joints of the neck, also known as cervical osteoarthritis. This condition usually appears in men and women older than 40 and progressive with the age. But nowadays, you can see the children, Bangalore with the Bhagata sir, children wearing the neck collar. Why? Continuous work. Although cervical affects both sexes equally, men usually develop at an earlier age because they are more prone to computer. What are the symptoms? The usual symptoms of cervical spondylitis bring the patient to therapist are a stiff and painful neck, shoulder, arm or chest pain, numbness, tingling or printing sensation in the arms, hands, legs or feet, lack of coordination, difficulty in walking, abdominal reflexes, loss of bladder or bowel control or urinary abysmal. What happens? The pain which is generated at the cervical part radiates to the hand and पूरा हाथ में दर्द पेन होता है. It also part stretches to the lower part also. Okay, arms, feet, and all. Okay, so that is the reason behind that. Okay, uh, lack of coordination, difficulty in walking, abdominal reflexes, loss of bladder or bowel control, or urinary discharge. Technostress and the accompanying psychophysiological changes due to the modern computer age are important factors in the ethopathogenesis, and there is no escaping a computer anywhere, anymore, anytime. Aging and wear and tear on the spine are major risk factors for spondylitis. The person is more likely to develop spondylitis if they had a previous neck injury. Okay. Wearing a collar is only a temporary phenomenon. Painkiller, taking the painkiller is only a temporary phenomenon. Taking the painkiller, wearing the collar throughout the day and reduce and removing it through the exercise slowly will have a muscle get relaxed and the working condition of the cervical will improve. So it will take a slow process and then only it will improve. Okay. Specific now try and loss of elasticity in the spinal and cervical, bulging and sometimes herniation on disc, so that disc material protrudes from between the two vertebrae, stiffening of the ligaments connecting the neck bones. Okay. Simple mode of the neck with angular rotation of the neck, neurological examination of the neck to be examined with any stress in balancing the movement of the legs and arms, neck or the spinal X-ray, CT scan or magnetic MRI. A CT scan of the spine produces a more detailed image, while the MRI can produce a detailed cross-sectional images of the spine. Everybody knows CT scan is this much. Myelogram just involves generating images using CT scan after the dye is injected into the spinal cord for better visualization. Myelogram. Okay. Avoid high impact activities if the neck pain is present. Warm fermentation of the neck region. Avoid lifting the weights. Take the short breaks while driving, watching the TV, or working on computer. Work on the overall posture, keeping the neck aligned and shoulders. Take adequate rest. When lying down, it is the best to lie on the side. Avoid sleeping on the face. Use a thin and a hard pillow to support the head and the neck. Usually, those who are having cervical problem or in future also, they should avoid the pillow. Those who are habituated with pillow, they just slowly reduce the support of the pillow. And as the age grows, your water level increases. So it's better to have remedies for treatment of the water level. Okay. Development of osteoarthritis, development of the joint pain, development of rheumatic arthritis. This can be the possible reason as the age grows. Okay. Your morning practices will take care of the day activities. Okay. It will not, because when the practices are more, when the practices are very deep, the resistance power to the this will increase. Okay. I sit for hours together on the computer. लेकिन by God's grace अभी तक कुछ नहीं होंगे because of the regular kriya, regular practices that can be the reach. Sushma to facilitate the healing energy throughout the body. Vyagra pranayama with awareness of the movements at the upper back with the breath. Chin kriya with awareness of the movement at the back of the back. Postures to strengthen the upper back. Standing Tadasana, Ardhakari Chakrasana, Ardha Chakrasana, Nirvasana. Gomukasana, Mandukasana, Dandasana, Shashangasana, Ustrasana and Pratihalasana. Pratipahalasana. Pratipahalasana. Ustrasana. Vibhava and Pranava Pranayama, Sachalam Picha, Adhyam Pranayama and sound for head and neck. Makar sound, Brahmani. Nadi Shuddhi and Brahmani help in reducing the stress level. Okay, Nadi Shuddhi Pranayama. Kriyas such as Jalditya and Kunjal Kriyas, Brahma Mudras for the head and the neck region, Shavasana, Yoga Nidra and Ajapajapa. Low back pain. We come to the cervical, lower back. It 12 plus 7, 19. Lumbar spine, 5. Above the fused bones. Fused bones are this one, neck bones. त्याच्या वरती 5 बघा. You see in this lumbar spine, the space between the intervertebral disc, the space between two discs are much more than the space at the thoracic level. You will hardly find anybody with T1, T4 or T5, T6 any problem. All problems are at cervical level or other problems are at lumbar spine. Okay, L4, L5. Riding bicycles for 10, 15 years, 20 years on a bad roads in Mumbai or rural place will slowly have problems on the lumbar spine. One of the lumbar spine is L4, displacement of L4, L5 is slip disc. I like a slip disc. Usha, Gopinathan, slip disc, suna slip disc. Very painful treatment. Gopinathan, L4, L5. Very common at lumbar spine L4, L5. Displacement. Here it is. 1, 2, 3, 4, 5 at this region. Such patients को आपका पास आएगा when the treatment is going on. You should not go for forward bending under any condition. See, general principle is while exhale you go for bend forward and inhale and come back. So इसको backward bending सब ज़्यादा slowly try to improve. Patient को आएगा, you have to first see the condition of the patient and then start the treatment. Usually you start the treatment through pranayama. See the condition of the patient, see the improvement in the condition of the patient. Okay. अभी ये lumbar spine वाले को उसको नीचे नहीं बैठ सकता है. Then make him comfortable sitting in the chair, whichever this one. Okay. See that this one is should not do kapalbhati because that will have a back pain. That will aggravate the back pain because active expulsion. Initially नहीं करना है. Initially deep breathing करना है. So see that the oxygen air passes on through his entire vertebral column, thereby giving an improvement in the air. Normally, the patient in a normal condition does not do deep breathing unless the doctor tells him deep breathing. The volume of the air and deep breathing is 5 times more than the normal breathing. अभी inhalation exhalation चल रहा है सबका. Okay, at each minute it is 500 ml each breathing. When a deep breathing comes, it goes to 2500 ml. Okay. So that 2500 slowly, the resistance power will increase, and slowly the whatever the parts which are affected, that will get slowly healed up, supported with the medicine which you are taking. Supported with the medicine you are taking. Okay. So Coming back to lower back, this is a common, this one. It's a very common condition, albeit a uniquely experienced one, ranging from the dull or the throbbing aches of the spine osteoarthritis to the shooting sharp pain of a ruptured disc. Ruptured disc. Back pain can also come and go, be constant, worsen with exercise, or prolonged sitting on or be associated with the neurological symptoms like numbness and tingling. While back pain can be frustrating and debilitating, the upside is that the majority of episodes of back pain improve or resolve with minimal care and usually within a few weeks. Yes. Muscle strain and spare are the most common cause of back pain, especially in the lower back. A strain refers to a tearing of a muscle or tendon, while a sprain refers to tearing of a ligament, a fibrous tissue that connects the two bones together. What is a ligament? A fibrous tissue that connects the two bones together. So in between the intervertebral discs are bones. Okay. So ligaments get connected to that, which results from an injury. While this tears result like lifting up couch or gradual overseas inflammation occurs, causing pain and in some cases muscle spasm. Spinal discs are located between two adjacent vertebral columns and 1 minute. And a shock for a combination of reasons, including the natural process of healing trauma to the spine, weight gain, smoking, and repetitive stress to the spine. Osteoarthritis. Osteoarthritis, when you say, how many types of arthritis are there? Osteoarthritis are related to patella, kneecap, and others are the pains in the joints, elbows, rheumatoid arthritis. Rheumatoid arthritis is very rare, but osteoarthritis in the Vata stage of Ayurveda is more. I am a chronic patient of osteoarthritis. Okay. It is a natural degeneration process. Arthritis can affect including the small joints of the spine. Spine arthritis occurs as a result of wear and tear of the cartilage located between the spine joints. As spine arthritis progresses, the body makes new bony growths to stabilize the joint. These bone spurs can eventually compress nearby spinal nerve roots, causing numbness and tingling similar to that of a ruptured disc. How many spinal nerves are there? 31 pairs of vertebral column. 33 pairs of spinal nerves which emanate from the in between the disc, intravertebral disc, and connection to the nervous system. Intravertebral disc का बीच में से spinal nerves जाते हैं, which are very this one. Okay. Sciatica. Everybody knows, refer to the compression pinching of the sciatica, often called the herniated disc or the bone spur. An injury, trauma to the pelvic, buttocks or thighs, diabetes, prolonged sitting, and reformer syndrome when a small muscle in buttock spasm and irritate the sciatica nerve may also cause sciatica. Sciatica is one of the biggest nerve, starting from the pelvic region to the leg, biggest nerve in the body. Okay. एक MCQ में आएगा this type of questions. Osteoarthritis refers to what? Yagas, patella, shoulder joints, or elbow joints, which are the joints affected. Okay. Then like such questions can come. Spinal stenosis causes back pain in the aging population. As you get older, the spinal canal gradually becomes constricted or narrowed due to in part of osteoarthritis and the thickening of the tissues in your spine. If the spinal canal becomes too tight, nerve roots may become compressed, causing neurological symptoms like weakness, numbness, and tingling. Spondylitis refers to a stress fracture in one of the vertebrae of the spine. This condition is most common in children and adolescents who play the sports such as gymnastics or footballs, or plays a repeated stress in the lower back. Spondylosis. If a stress fracture weakens the vertebrae too much, the vertebrae becomes unstable and begins to slip. This condition is spondylosis. Symptoms of spondylosis include pain and stiffness at the site of the slipped vertebra. Okay. Osteoporosis. Pores in the bone is known as osteoporosis. Simple. Osteo means degeneration. Pores means hole. Osteoporosis. Ladies post menopause. So many changes in the endocrine system takes place. So the degeneration takes place. Osteoporosis is one of very weakening and very worst. My mother had the spinal osteoporosis, which made her bedridden for nearly 10-15 years. My mother. बेड में ही सोता था. बेड से उठकर टॉयलेट जाने को भी इतना डिफिकल्ट होता था. Okay. Diabetes also was one of the reasons. 35-40 years diabetes. The pain of a vertebral compression fracture is often felt in the lower back or in the middle of the back. Rarely the pain radiates to the other areas of the body like the abdomen or the legs. Generally speaking, pain from a compression fracture or often worsens with motion, ease with the rest or lying down, and ranges in the quality from the sharp to the dull. Okay. Ankyloscoliosis. Scoliosis is the condition with the spine curve twist and like the letter S or the letter C. It usually develops in childhood or during adolescence. In most cases, the cause of scoliosis is unknown, although it may be related to injury or the birth defect. In some instances, multiple family members will have scoliosis, suggesting a potential genetic component. Ankylosing spondylitis is a chronic inflammatory disease of the spine joints that causes the low back pain and stiffness, typically starting before the age of 40. The back pain of the ankylosing scoliosis tends to improve with exercise and worsen at the night. Asanas recommended are Vajrasana A and B, Adho Mukha Svanasana, Trikonasana, Bhujangasana, Cobra pose, Naukasana or locust pose, Setu Bandhasana, Ardha Matsyendrasana, two knee spinal cord, Uttan Vakrasana, Shashangasana. So, Siddhit, you are all aware of all these asanas? Practical session, you will take all the asanas. Siddhit,
हाँ
all these asanas you are well aware.
शीर्षासन नहीं है.
Huh?
शीर्षासन शीर्षासन
Which one?
शीर्षासन
Gopinath, what is you saying?
Shirshasana, headstand.
That is an advanced posture, hai, Baba. You can do Shirshasana, means you can do all these asanas. Huh?
He can't do Shirshasana.
Huh?
He can't do Shirshasana, he said.
But
He should-
okay, then chalta hai. You go at the syllabus. Syllabus में simple asanas है. Level 3 के लिए. Don't worry. Nadi Shodham Pranayama, Kumbhak Pranayama, itching sound, inhale very deeply and exhale through the mouth. Next comes osteoarthritis. You can see a normal condition of the bone. Bone, two sides of the bone, the cartilages, and the joint capsules. This is a normal. This is a person with osteoarthritis. See the ligaments, cyst which is developed here on either side, due to which the separation has taken place, and there is a movement of the cartilages. Okay. Irregular joint space, fragmental cartilage, loss of cartilage, sclerotic bone, or cystic change. Advanced osteoarthritis, still the space has become much more. So it may lead to the swelling. Okay. See, the size of this is constant. Even the degeneration has taken place at this part. See the cursor. Which are these? These are osteophytes. This they term it as osteophytes. A small inflammation caused here. These are the osteophytes. Osteophytes. Osteoporosis and osteophytes. Okay. ഒരു minute. I'll call. Next. Joint instability, peripheral neuropathy, prolonged occupational sports stress, prevalence of knee osteoarthritis increases with age. Symptoms of osteoarthritis present as pain in and around the joints, morning stiffness, restricted joint movement associated with muscle weakness, knee associated with disrupted sleep, depression, increased sedentary behavior, less physical activity, obesity, and decrease the quality of life. Bilateral knee osteoarthritis impair the balance and increase the risk of fall, particularly people with moderate knee osteoarthritis. Okay. Now, what are the yoga mind body intervention originated in India? Different schools of such as Iyengar Yoga, Ayurveda of Esvasa, Hatha Yoga, etc. developed a therapeutic intervention for knee osteoarthritis. Iyengar Yoga, BKS Iyengar Yoga are with external supports. External supports. I've been undergoing the treatment for my scoliosis. अभी जाके आए मैं बुरुली में. Rope belt therapy (RBT), which are developed by BKS Iyengar. And osteoarthritis is Ayurveda concept you know, no? Vata, Pitta, Kapha. Vata is at the old age, Pitta is at the middle age, at the adult age, and Kapha is at a young age. Okay, that's a the children, not the developing children, they get prone to the disease very fast. Okay, that means the rate of the Kapha is much more. And as the mind and the body increases, as the organs start developing, as the age grows on, the Kapha stage comes down, and this increases, the Pitta stage increases. That's why acidity, all the types of diseases they get. Okay. A pilot study was considered of 9 participants using modified Iyengar postures, 90-minute classes once in a week for 8 weeks as a treatment modality, and showed the potential reduction in pain and disability caused by knee osteoarthritis. Few other studies compared in the yoga therapy with different interventions such as traditional stretching and stretching exercises or no structured group for 6 weeks and showed the functional changes and improvement in the quality of life in traditional practice and yoga. It was followed by Ayurvedic, integrated approach to yogic technique, a specialized module of SVSS, integrated approach based on the Panchakosha on Taittiriya Upanishad. Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vidyanamaya Kosha, Anandamaya Kosha, on the Panchakoshas. Okay, very beautifully they are designed each and every structures of Ayurveda. Integrated approach. We have studied in detail in the MSc. Okay. It was followed by Ayurveda intervention and reported that Ayurveda is better than physiotherapy exercise for reducing the pain, morning stiffnesses, state and trait anxiety, blood pressure, and pulse rate. Okay, these are for osteoarthritis patients. The study was limited to numerical pain scale and state and trait anxiety. Meta-analysis of yoga for musculoskeletal problems suggests that yoga is helpful for chronic pain and low back problems in older women population. Okay. What are the yogic postures? Vrishtikrasana, Surya Namaskar, Shashankasana, Vedic. Majrasana A and B. Uttan Vakrasana, Setubandhasana, Parvatasana. Anjaneyasana, one leg back, one leg front with hands in Namaskar. Pelvic twist. Pranayama, Brahmani, Ujjayi, Anulom Vilom, Kapalbhati, Shitani, Shitkari. Besides Surya Namaskar, effective in curing the joint pain. NCDs, non-communicated diseases. Which are the non-communicated? Yoga is an essential practice to increase the physical and mental activity and prevent the occurrence of NCDs. Yoga practice can improve the functioning of different systems of the body, physiological well-being, and improve the oxygen delivery to tissue, remove the metabolic waste product, carcinogens, and cellular toxins, and scientific evidence has begun to emphasize its efficiency. It helps to get rid of the toxic substances which create disturbance in the body, non-communicable disease. Okay. In this review, the authors explain the role of the various non-communicable in the management of 4 types of diabetes mellitus, respiratory disorders, cardiovascular disease, and cancer, based on the evidences from the various literatures and literatures. Which are the common types of non-communicable diseases are diabetes mellitus, respiratory disorders, cardiovascular disease, and cancer. NCD is the ailment that are based on the routine habits of the people. Sedentary lifestyle is the leading cause for health issues which leads to non-communicable diseases. You can correlate with the respiratory disorder. You can correlate with the diabetes. Though it is said it's hereditary, but more so on the living function. Respiratory disorders are the lifestyle problems. Cardiovascular disease also can be attributed to lifestyle function. Okay. And cancer, the cells get destroyed of the particular organ which is weakening in functioning. Okay. Yoga helps the human being to take his body healthy and fit. It helps the man to get rid of the toxic substances which create disturbance in the body. To reduce the NCD related premature mortality, regular practice of yoga must be implemented. In this short review, discuss the various roles of yoga practices. ഞാൻ ക്ലാസ്സിൽ കാണുന്ന പിന്നെ വിളിക്കാൻ ഞാൻ ഓക്കെ To reduce the NCD related premature mortality, regular practice of yoga must be implemented. In this short review, discuss the various roles of yoga practices for the management of 4 major NCDs. Okay. Diabetes, asthma, recommended diabetes are Surya Namaskar, key to do a yoga posture that it should be performed with stability and comfort. Asanas had a beneficial effect on glucose utilization, fat distribution in people with type 2 diabetes. In patients with diabetes, the pancreatic cells may be regenerated and the beta cells activity sensitivity in the pancreas may be increased by the alternate abdomen contraction and relaxation involved in the yoga practice. Improved blood supply. जल्दी करना वो बात तो blood supply to the muscles may enhance insulin receptors expression in the muscle, causing increased glucose uptake. So noting that ideal control diabetes was done by Dhanurasana, Ardha Matsyendrasana, Halasana, Vajrasana, Bhujangasana, and Naukasana. Okay. Yoga for respiratory diseases. I have gone in detail. I prepared this slide 1 year back, 2 years back. Very detailed I have gone in. The regular practice of pranayama will lead to good supply of the oxygen to the lungs. Respiratory rate becomes slower. This slower breathing rate will activate the parasympathetic nervous system, which helps in reducing the stress and regenerating the body. It strengthens the diaphragm and remove the impurities from the breathing tube. Some of the beneficial postures are Bhujangasana, Viparita Dandasana, Dvipada Viparita Tadadandasana, Urdhva Mukha Svanasana, Ustrasana, Sukta Vyasundasana, Dharurasana, Setubandhasana, Sarvangasana. Lungs and other respiratory organs requires an adequate fresh and healthy blood to prevent the disorders and disease. This is obtained by way of gravity, inverted posture, and through the method of squeezing and sweating. In inverted postures such as Shirsasana, Shalabhasana, Sarvangasana, Halasana, Setubandhasana, and Viparita Kani Mudra. Cardiovascular disease. By doing the above practices, circulation throughout the human body is altered and areas above the heart receive an increased supply of blood. It should also be noted last two posture mentioned, Sarvangasana and Viparita also have the additional respiratory benefit of stretching and massaging the diaphragm. Because of the inverted posture, toxicity postures of Sarvangasana and Viparita, the flow of the blood toward the brain, toward the upper part increases the, because the flow of the blood is always toward the gravity. One minute. One minute. One minute. Cardiovascular regular practices of yoga results in an improvement in lipid profiles, heart rate variability, decrease in the blood pressure, and even regression of the atherosclerosis when combined with the proper diet and lifestyle modification. Meditative postures can also reduce the potentiality of artery clogging stress hormones. Examples of such postures are Sukhasana, Child Pose, Balasana. These poses contribute to the mind-body awareness that impacts their lifestyle, such as mindful eating. Poses like Utkatasana, Navasana, and Dolphin Tank posture work for your heart while they develop sports strength. Flowing the yoga poses such as sun salutation increase the heart rate, thereby reducing the resting heart rate. This helps the heart to pump the blood it needs to the rest of the body efficiently. Yoga for cancer. Asanas and prana together help keep the mind cool and prepare the mind to overcome the sensory stimulus and reducing the thought by helping one to focus and concentrate. Yoga is not the only remedy for cancer patients. All chemotherapy, radiotherapy has to undergo. Only yoga can reduce the stress which is created out of the after effects of the radiotherapy and the other therapy used in the cancer. Okay, chemotherapy, it has a very painful level it is. Cooling pranayama have been useful in managing CNV along with the Pawan Muktasana and Uttana Padasana. I told you I'm treating a ovarian cancer patient. She is going to work in the bank. She is working in a bank. Okay. So 27 to 30 cycles, 35 cycles are over. I go for the advanced relaxation of Vishwasa on the pranamaya portion. Complete holistic healing. Very advanced level. This is a pranic analyzation technique. Then for Manovaya portion is mind sound, the MSRT, mind sound resonance technique. Okay. Cooling pranayama have been useful in managing the CNV along with the Pawan Muktasana and Uttana Padasana. In their RCT trials note down that loosening exercises, gentle stretches, yogasanas, Sudarshan Kriyas and relaxation techniques have been more effective in managing the fatigue pain and sleep problems. Techniques that use the postures interspersed with relaxation techniques, cyclic meditation, movement meditation have been found to be useful in reducing the stress and improving the sleep. Okay. Yoga reduces stress hormones, HPA axis regulation, and improve the parasympathetic function that reduces the stress and modulate the response to stressors and install a greater control over situation. This is particularly useful in cancer patients who perceive the cancer as a threat and constantly ruminate on its fear. Depression causes abdominal elevation or diurnal cortisol leading to insomnia and immune suppression. Yoga helps in the reduction of depressive symptoms by changing the perception, improving the fatigue, improving the sleep, and consequent immune response. Yoga modulates the psychoneuroendocrine and psychoneuroaxis therapy, restoring the homeostasis and reducing the allosteric load. All pranayama has to be done without kumbha. Patients not to do Jalandhar Bandh, not to do Udyan Bandh, not to do Moon Bandh also. Without kumbha, Bastrika not to be done any therapy. Benefits of yoga and yoga is based on principle mind and body are related. Yoga has many health benefits such as improving physical fitness, relaxation, awareness of the self, then accepted widely in society because of its safety and physiological benefits. Yoga practice can improve the function of different systems of the body, foster psychological well-being, and improve the oxygen delivery to the tissues, remove the metabolic waste product, carcinogens, and cellular toxins. And scientific evidence has begun to emphasize its efficacy. We now consider low-cost intervention to control the various lifestyles. And also, yoga helps in managing stress. Yoga incorporates meeting and regular yoga practices, which can breathe overflow. Yoga is an integrated medicine. Yoga can help in deepen your meditation practices, improve your flexibility, help with the balance. Pilates will be better for recovering after injury, improving the posture. Okay. Thank you, sir.